Welcome to a teaching session on supporting health. So before we get started, again, just a gentle reminder that this is not to be copied. I would like to encourage you to put things in your own words. Also as well, please ensure where possible, and with this unit you will be able to give examples of your practice. So think about things that you have done within your job role and use those to be able to answer the questions. By doing this, you actually are able to meet some of the criteria much easier and more detailed as well. So please ensure to try and give examples. So the first question we're going to be looking at is outline and explain the range and functions of health agencies and services available locally. So we're going to look at a different range of health agencies. So we've got things like obviously your dentists, your opticians, hospitals, walk-in centres, your doctors, GPs, CAMs, rehabilitation services, pharmacies. So think about this and think about how you use these services. How far are they away? And what I want you to do when you're answering this question is I want you to, again, refrain from listing. I need to have the health agencies available, but also what do they do and what do you use them for? So if it's a dentist, you could talk about, we have a dentist, we have lots of dentists local to the home. It is quite difficult to access dentists at the moment due to the NHS crisis with dentists. However, it's imperative that we support the young people to attend dentist appointments. Therefore, we will spend time locating a dentist for the young person, and this is to ensure that the children and young people have good oral hygiene. It supports us to be able to identify any damage to their teeth, or do they need any braces even. That's the kind of thing I'm going to be looking for when you're answering this question. So give examples of what you might be using these services for. You may have more closer to you, and again, put that down. But just refrain from listing. I need to have sentences. So the next question is, I want you to explain to me the impact on a child or a young person that are not able to register with the primary health services. Now, I know that when you get a young person in residential childcare, the first thing you have to do is register to all of those health services, doctors, dentists, opticians, and so on and so forth. That is your main port of call. But like I said earlier, there is a big crisis at the moment with dentists, isn't there? So think about how difficult that is to actually access a dentist, an NHS dentist at the moment. Now, I want you to think about perhaps that you weren't successful, perhaps that a young person wasn't able to register for, maybe there's a multitude of reasons. Maybe the social worker hasn't signed the paperwork off, maybe the child is an outreach patient child, and maybe the parents are refusing this. Think about what the impact would be on that child or young person. I always pick dentist to give an example on this one, because if a young person wasn't able to access a dentist, it could result in, obviously, poor dental hygiene, things down from simple as bad breath. They could have rotten teeth. They could then result in pain with their rotten teeth. It could even go further. They could lose a tooth. Therefore, if you've got a child that's suffering with poor oral hygiene, such as bad breath, if they have got a rotten tooth, or even if they've lost a tooth, obviously there's a lot of physical impact, isn't there? So it's going to cause them pain, it's going to make them feel uncomfortable, it's going to make them irritable. But think about also their mental health. How much would that impact a child or a young person? Or even think about yourself if you was to lose a tooth, especially if it was one of the front teeth. It can have a detrimental impact on a young person, especially when they're having to go to school and they're having to socialise with peers of their own age. So think about that. Obviously, you've got a massive range there. So, if you've got, they can't register them to a doctor's, you're going to have increased emergency visits to the hospital. I've had it happen before where a child has been transferred to ourselves and the social worker hasn't signed the paperwork off correctly, so we couldn't get them registered with the GPs. So we were actually taking the child to the emergency services, taking them into the hospitals for headaches and things. So it does have an increase on that. If you can't get them to opticians, dentists, it's going to have long-term health consequences. There is a situation with opticians. They do advise that, if they've got children, young people who do need glasses, they should get them and they should wear them. And if they don't, their eyesight's going to get worse. There's going to be not any improvements, it's going to get worse. Therefore, think about it. Your eyes are struggling, you could have headaches, you could have blurred visions, could even make you feel sick. So there is a lot of impacts out there. So again, you might be able to use personal experience to answer this question, but please, again, ensure that you answer them in sentences and where possible, give those examples. So I want to look at barriers now. So it says describe barriers to accessing health services. There is many barriers for children and young people when it comes to accessing these health services. I've just mentioned one earlier, didn't I, with the dentist. The dentist is really, really difficult at the moment. So lack of accessibility is a barrier. But a big one that is always really, really, really familiar is fear. Now, I've worked with lots of young people in my time, and I've worked with lots of young people that have that attitude of, no, I'm not going, I'm not doing it, no, I don't want to, don't need to. Quite often not, that attitude actually stems from fear. You've got to always remember and be mindful of the fact that these children have perhaps never been to a dentist, or if they have been, it could have been a really negative experience for them. So think about that fear and think about how that must be impacting them. So you've got things like obviously geographical distance. So, there could be a situation where the young person needs to have a specialist. I don't know, maybe they need a specialist for physiotherapy or something, and you have to travel, and it's going to be 2 or 3 hours to get to where you need to go to. That could be a massive barrier. A child's not going to want to sit in a car for 2 or 3 hours. They're going to be very much, no, don't want to go. It's fine. I want to go. I don't need to. I've put on here sensory needs. I have experienced firsthand taking a young person to an optician's appointment with autism. It was one of the longest experiences of my life in a health service. Because of the close proximity, the eye test and the optician was getting to the young person, it was causing her immense discomfort, really, really immense. We had to keep having regular breaks. I had to take her out, take her for a walk around the town first, and then try again. It was a really, really massive barrier. I mentioned earlier about appointments not being available. We said dentists are really difficult to get hold of at the moment. If you look at more of the outreach element of it, if you're looking at the children that you're supporting in the community, the parents could have a lack of knowledge, or if not just a lack of knowledge, they could have a real negative attitude towards health agencies. I don't want my kids going to the doctors. They don't need the dentist. I never went to the dentist. They could be fearful themselves, and they're displaying their fear onto their children, and therefore it's causing, again, a rippling effect through the generations. There is a massive thing around lack of awareness around the importance of things such as, vaccinations, importance of having regular treatments and at the dentist and checking. There's lots of young people, quite a lot of young people I've worked with have really, really, really bad dental hygiene. They've never been. They won't brush their teeth. I looked after a child who had multiple extra teeth and the teeth were very, 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 very crooked. But I remember when I was a child, I had crooked teeth. Oh my goodness, I was always conscious of it, covering my hand over my face. It can have an impact, but having that fear or that lack of understanding of, do you know what, a brace that might actually help you, especially with speech. So many times that I've noticed that when you have a brace, it alters your jawline and it can actually help you to speak more clearly. Sometimes it can even mean you might have to have teeth removed, or you might have to have your jaw realigned. So all these things, I mean, I've gone to different levels here, but all of these things are potential barriers. But again, think about your experiences. Think about where you've identified a barrier. The next question, we're going to look at how you're going to overcome those barriers. So we've spoken about within the home, we've spoken about children who have a fear of going to these health appointments. How are you going to overcome it? Well, quite often or not, some children and young people might just need to be educated. You might need to teach them. You might need to have that chat with them. You might need to show them pictures. You might need to take them to show them where it is. You might need to even then take them into the building. Offering that multi-agency approach with those other professionals, explaining to the GP, explaining to the dentist or the optician, this young person's really nervous, they're really wary, they're really worried about this. Those sorts of planning ahead of time will help this child or young person overcome this potential barrier. The sensory need, I worked with the opticians in that example of when I said that young person had autism. I explained to the optician, that there was going to be a period of time we needed to get used to it. The optician worked with me. We did it in breaks. We did it in breaks between his appointments, and that worked. Sometimes it can be really quite simple. You could well just send the young person to the health appointment with their favourite staff member. And I know it's really, really difficult because you're having to be really mindful of not allowing a young person to dictate and control staff. I understand that. But when it comes to something as important as health, obviously, again, where applicable, because children are all different, but when it does come to something as important as health, isn't it just more, I don't know, manageable if you can send that child with that favourite staff member? At least they're going to be attending the health appointment. Especially when you've got this relationship built. We all talk about positive attachments, positive relationships. Let's use them to the best of our advantage. Let's get the kid to the appointments. Let's get them going. If it's a locational distance, we might be looking at perhaps trying to move or transfer the patient to another provider which is nearby. Is there a physiotherapist nearby? There's lots of schools that do as well, school-based health services. So some of them can actually support you with vaccinations, and they do a lot of education as well around health. So there is many ways that you can overcome barriers, but do be mindful that a fear is the most common one that you're going to come across. When you're looking at outreach, and when you're looking at the parents' attitude or the parents' lack of knowledge, in this instance, you are going to be working with that parent. You're going to be trying to educate them. You might even offer, do you know what, I understand that you may have a fear, or I understand that you may not have an understanding of it, but I'm happy to do the appointment if you like. I'm happy to take the child, young person. You're going to work with the parent and you're going to figure out how to get that child the health appointments it needs. And if that means that you have to take them, that might be a case. You might have to work with the parents. You might have to educate them. You might have to even support them to take their child. Think about it. Think about what you do and how you do it. So the next question we're going to go through is describe a range of health concerns that could potentially develop in the life of a child or young person. Now, There is many, many, many different health factors or health concerns that can be developed. Quite often not, I'm going to mention some of the most common ones is sleep disorders. How many children have you worked with or are you aware of that have an absolutely diabolical sleep pattern? They stay up until 12, 1 o'clock in the morning, they can't get to sleep. And even though they've come into the home, or even though you're trying to support them now and you're trying to change that, because they've got into such a bad habit, it's quite difficult to rectify. But sleep, especially for children and young people, is imperative that they have good level of sleep. It will impact their next day immensely. So trying to get that really good sleep pattern will help them long term. Children who have come from traumatic backgrounds, has been a victim of abuse or harm or neglect, there could be some mental health issues there. These are really important that you get the support need of the child. I know it's really difficult at the moment. I know how difficult it is to be able to access CAMS for children and young people. But there is lots of services. Think about all of the signposting that you can do for outreach, such as Young Minds and SPCC, even Childline as well. These are the outreach, or even within the home, that you can actually signpost the children to. There is substance abuse. How many children and young people have you worked with who have come from perhaps backgrounds of where substance is an issue? They may well have been neglected. They may well have been roaming around the streets. They may well have got themselves involved with people who smoke cannabis, drink alcohol, or even worse, dabbling in Class A drugs because of the neglect. If they've come from a background where that's what they're used to, that's what they've seen their parents do, it's really common that a child is going to follow that pattern. Again, they're looking for that role model. And if the role model is poor, they're still going to copy that pattern. So there could be a level of substance abuse as well. We're talking about all of these factors, but all of these factors we're looking at, we've got to look at why we're identifying them. If we don't identify these as early as possible and try and support these as early as possible, these health concerns can stretch out into their adult life. It can have detrimental effects on them as adults. You know, substance abuse, if we do not try and put the education in where possible, as an adult, think about it. If you've got an alcoholic, if you've got someone who's addicted to heroin, as an adult, they're less likely to be going to work. They're less likely to be living what we would hope a good lifestyle is. Personally, one of my biggest ones when I talk about this, as some of you might have experienced, is eating habits. Now, I've worked with so many children, and I would say a large majority of them have eating difficulties and eating habits. Now, I've worked with children that overeat. Now, quite often not, when they come into the care sector, they can overeat because they've never been fed properly. So it's kind of like trying to get it as quick as they can. Some of them will undereat. And this is when we're looking at children who are at risk of anorexia and bulimia. Think of the damage this causes to these children's body. And it works both ways. If you've got a child that's overeating, the damage is obviously diabetes. We're looking at excess fat. We're looking at damage around their vital organs. And that can go on into adulthood as well. And adulthood, diabetes, well, we know if you've got diabetes, you've got risk of losing limbs, damage to organs, damage to your eyesight, and obviously even heart attack. But on the other end of the spectrum, children that undereat is just as dangerous. when they're undereating and starving themselves, the malnutrition is so dangerous to their organs. Their kidneys are under pressure, their liver, their pancreas, everything is stressed and strained. From some of my research and experiences of working with children with bulimia and anorexia, did you know that one of the biggest telltale signs for a child who is anorexic or bulimic is they have excess hair? And there will be a lot of hair around their neck, around their arm, well, basically around their shoulders, around their body. The reason why is the body is struggling to keep itself warm. So what it does is it produces more hair. So if you see a child that you think is a little bit underweight or even a lot underweight and you've got concerns, a telltale sign is the excess hair. Obviously we look for teeth, don't we, with bulimia, bad teeth, but also look for the excess hair. Anyway, let's move on to the next question. Again, make sure you try and answer this with examples as well, please. So, explain factors associated with healthy lifestyle. So, we're going to look at what is a healthy lifestyle. I know you know this, but let's have a little breakdown. So, healthy lifestyle, balance of nutrition, 5 a day. Let's get these 5 a day into these young people. Physical activities. So, very, very difficult sometimes, but you know what? Try and encourage them. Let's go for a bike ride. Or you want to go to the shops, right? Well, we're walking today. We're going to have a walk today. Let's get a swimming pool in the back garden. Let's get a football goal. Do you want to join the gym? Do you want to go kickboxing? Do you want to do boxing clubs? Let's try and encourage as much as possible. I spoke about sleep. Really, really important. That's good and just as important for a healthy lifestyle, good level of sleep. You've got to look at things like, keeping an eye on and monitoring a healthy weight. A healthy weight is difficult because a healthy weight is relevant again to individuals. No two people are the same. So we're looking at an overall healthy weight. I've spoken about substance abuse. We've got to be really mindful of substances. So we're going to do education around the damages of alcohol, damages about cannabis, class A drugs, things like that. We're going to educate around there. We also need to do a lot of education around nutrition. So we know that we've got to eat 5 a day. We know that. The children actually probably know that because they learn it at school, if they've been to school, that is. But what we need to identify and teach them as well is about the levels of sugar that they're consuming. Looking at those fizzy drinks, looking at those sugary sweets, looking at the chocolate bars, because they could well be having their vegetables, but sugar is really, really, really addictive, and it is really, really quite poisonous to us. So we need to get a good level of balance with it. We need to get them to understand the levels of what we should be having. So nutrition is a really, really important thing. Again, think about how you are role modeling this. It's really important. I worked with somebody, well, I had a staff member I worked with, and basically we would be preparing and educating the children, and at dinner time he wouldn't eat any vegetables, he'd order a pizza. What is he showing the children? He's not showing them anything. So obviously that had to be addressed ASAP, and we had to educate them on obviously the fact that you're supposed to role model this. So if we're sitting down and we're eating vegetables, you need to be eating the vegetables as well, as much as you can. I know, no one likes veg. There's not many people out there go, oh, I can't wait for a Brussels sprout with my dinner tonight. So just think about that. We've got to role model this as well. Again, you might even have an example. So again, where possible, give me those examples. Write down as much as you can of when you've done this. But you have reached the end of the session. I hope you found it useful. And then once you've done what you've done your written work, send it across. But well done.